Good morning. It's a pleasure to be with you today to talk about the future of nursing. I am Johnathan Holifield, Executive Director of the White House Initiative on HBCUs, and I understand Sue has a pretty definitive hook, so I'm going to try to get a lot in a very short period. I welcome the opportunity to speak with you today. Historically, black colleges and universities are a source of accomplishment and great pride for all of us. These institutions provide a culture that prepares students to contribute to their communities, a culture that builds confidence and gives them the skills they need to be successful. The schools are public and private, religious, non-sectarian, 2-year, 4-year, urban and rural, all representing the great diversity, the great variety that is the hallmark of American education. Over the past 150 or so years, HBCUs have built a legacy of providing high-quality baccalaureate education for nurses of all races, ethnicities, and backgrounds. The first school of nursing for educating African Americans began in 1886 at what is now Spelman College in Atlanta. Hampton University is the first university in Virginia to award bachelor degrees in nursing. These and other institutions principally, not exclusively, but principally for African Americans set a precedent for both HBCUs and other institutions to establish nursing degree programs. Importantly, in 2015, HBCUs accounted for 16% of all bachelor degrees earned by African Americans, despite being only less than 3% of the total higher education institution population, including 25% of bachelor's degrees in education and 22% of those earned in STEM fields. My fervent hope is that the future of nursing study, Future of Nursing 2020 to 2030 study, makes certain that HBCUs are an invaluable resource for meeting the high demand and high future job growth in the nursing profession. The Bureau of Labor Statistics projects a need of about 650,000 nurses in the workforce, bringing the total nursing growth for these jobs to nearly 1.1 million by 2024. HBCUs can help answer this shortage. Historically, people of color have been underrepresented in all the primary health professions. While the nation has been very actively engaged in a move toward health equity, the capability of HBCUs to provide professional training has sometimes been overlooked. We all know that diversifying the nursing workforce has many benefits. It helps increase access to better health care for all populations, reduce disparities in health, and achieve our shared goal of health equity. HBCU nursing has overcome many obstacles since their inception, and now we have new opportunities to meet growing BSN needs. I think the Future of Nursing 2030 study can move us a long way toward accomplishing these objectives. So what does it all mean? It means that we need a change in the direction and the approach to reclaiming, renewing, revitalizing the legacy of HBCUs and building our nursing workforce. Virtually all BSN programs are already near or filled to capacity. Upon graduation, nearly 100% of students earning BSN degrees will find jobs, in many instances even before they graduate. And we have developed, in partnership with AARP, Health and Human Services, Office of Minority Health, and VA, various programs to help improve the NCLEX passage rate among nursing schools at HBCUs. The White House Initiative on HBCUs is pleased to engage in this effort. We see exciting prospects to further partner with colleagues within the federal government and in the private sector to create groundbreaking approaches to bring HBCUs into the future of working. We look forward to working with you. And I also note this September, at the 2019 National HBCU Week Conference, we have dedicated a significant amount of real estate in collaboration with our partners, AARP, Office of Minority Health, VA Academic Affiliations, a 2-day workshop dedicated to diversifying the nursing workforce, mentoring for student retention, and NCLEX success at HBCUs. We hope to have your support now and in the future, and we look forward to contributing.